Hi everyone, and thank you for viewing my video. My name is Charlotte Warren. I'm a Master of Social Work, a licensed clinical social worker, a licensed clinical addiction specialist, and certified advanced alcohol and drug counselor. I'm also a former D1 college athlete. I was a diver. But today we are talking about PTSD, or post-traumatic stress disorder. So we're going to learn a little bit about what causes PTSD, what are some of the signs and symptoms of PTSD, and how can you learn and heal from it. So, I kind of fell into working with PTSD incidentally by getting trained in a intervention called EMDR that was primarily made for treating people with PTSD, and now it can be used with many other disorders and is very effective. But through my work with that intervention and people who have experienced traumatic events, I really became passionate about working with them because my philosophy is I don't want people who have experienced a traumatic event for that to affect the rest of their lives. So, someone who has PTSD, they have experienced some type of traumatic event, and that is kind of perceived by the person. There are some very common traumatic events that people will experience that may cause PTSD, and those can be, being in a car accident, child abuse, um, like witnessing domestic violence as a child, having any type of abuse yourself in a romantic relationship, can be verbal, or any other type of abuse from a coach or a parent, um, witnessing the death of someone close to you. There's lots of different things that can be considered traumatic. But what happens to cause PTSD is that traumatic event gets kind of stuck in our brains, and it almost can, for some people, can kind of be on a loop, and they kind of can't get unstuck from it. And so having a good therapist or someone who is trained in trauma interventions can help you kind of get unstuck. So some of the signs and symptoms of PTSD, they usually occur after a month from that traumatic event. So naturally, our brains will work through or process through the event within a month. But after that, if it's still stuck, then that needs a little extra clinical attention. And the time frame from when your brain will reprocess things or kind of get through things can change from person to person. But some of the things to look out for are you having common kind of thoughts going back to the event, maybe difficulty sleeping, a lot of maybe recurring images about the event. Also, a lot of symptoms of just kind of a down mood, kind of a negative outlook on life. You might be irritable or easily frustrated. Not being able to see the positives in things. People often have difficulty sleeping, either falling asleep or having nightmares, things of that sort. There also is kind of an avoidance set of symptoms. So, kind of purposefully blocking out thoughts, memories of the event, not talking about it to people. People will sometimes engage in substance abuse because of this. They'll try and kind of numb the thoughts, the memories, to try and get past it. Just lots of symptoms that can cause a lot of difficulties in your life. And so how this can affect your sport or how it may manifest in your sport, you may have difficulty concentrating, because of those thoughts and memories and things kind of going on in the background. You may just not be performing as well because there's so much kind of outside of your sport that's going on. You also may not be sleeping well, so that may also show some decline in your performance. You may get kind of frustrated with teammates or coaches more easily, having just overall negative thoughts about yourself, your performance, kind of beating yourself up a lot, or just may not be able to see kind of your future or seeing your future as really dim. So this happens because that trauma gets stuck in our brain and we're trying to process it, and our brain is always trying to process it, but you couple in, the difficulty sleeping and the avoidance that often comes with PTSD, and our brains aren't able to get unstuck. So that's where seeking help from a counselor, or a psychiatrist, any type of mental health professional who can help you work through the event, process the event, even possibly get you medication to help with sleep or other symptoms that you may be having during the day, um, will really help kind of get that processing moving so that you can move on and move past the trauma. So, some other things that you can do on your own in your healing journey is journaling. I mentioned earlier that not processing or kind of trying to avoid the trauma is a common symptom. And that's because it gets so big that, we don't want to address it, we don't want to face it, and our brains just kind of shut down, avoid it, block it out. But on your own or with a mental health professional, trying to journal about it, trying to talk about it, processing your feelings, the thoughts, the things that kind of are tough to talk about, and really trying to address them. Um, and then just also making sure that you continue to have positive coping skills. So spending time with friends, doing hobbies, spending times outdoors, anything that you find relaxing and, just helps you kind of cope and get through things. You want to make sure that you're trying your best to get as much sleep as you can, and also avoid substance abuse and alcohol use, as that can often make those problems worse, that trauma worse. And unfortunately, sometimes PTSD and alcohol or drug use will go hand in hand. And so you really want to be cognizant of that. But healing, it is possible, and there is always hope in recovery, no matter how extensive or how horrible the traumatic experience was. It doesn't have to affect your entire life, and you can heal and you can recover.